Hello, I'm Dr. Torak with Urban Veterinary Associates. I'm here today to touch base with you and help you better understand what to expect when your dog is having surgery. My nurse Teagan is here and will be asking me some questions about it, and we hope we're able to help you better understand more about what your dog will experience while they're here with us. So, Teagan, what questions are burning in your mind?
So, Dr. Jess, what do I need to know before my dog has surgery?
So there are a couple things we want to know before your pet has surgery. We want to know how old they are they healthy, do they have stable blood work, normal kidney and liver function so that they're able to metabolize those medications properly. And we also need to know what their environment is like at home so we can help you set up the best ways for them to recover.
Will my dog need lab work done prior to having surgery?
Yes, we always want our pets to have lab work before surgery. Just like humans, things can change pretty quickly in a patient's life, and especially because dogs age 7 times faster than we do, it can be really common for them, even if it's only been a couple of months, to have some pretty significant changes in that blood work. So we usually here at Urban Vet, as an accredited practice, we like to make sure our pets have had lab work within about 30 days of their procedure. We also like them to have an EKG, just like in humans, right? There are sometimes things can be going on with their heart that may not be audible when we're listening to them in the exam room, and so we want to make certain that the electrical conduction and the rhythms are proper before we get them under anesthesia.
Does my dog need to see a specialist before their surgery?
Not usually, right? So unless we uncover something specific in their blood work, their EKG, or their physical exam, specialty care isn't indicated for every patient. So trust us as your veterinarians to let you know when that might become necessary.
What will my veterinarian be looking for in the pre-surgery lab work?
Right. So we're looking specifically to make sure that the liver values are normal because a lot of the medications are metabolized through the liver. We're looking also to make certain that they have adequate red and white blood cell counts, their hemoglobin is normal, that they don't have any obvious signs of inflammation, that their kidneys are working okay, that they don't have any electrolyte imbalances that may affect their cardiac function. So there's quite a lot of information that we uncover in that pre-surgical workup.
Who will be monitoring my dog while under anesthesia?
Teagan. So at our practice, we have at least 6 certified veterinary technicians, which is a really great number to have. It's difficult to acquire great talent and to keep them on board. So nurses like Teagan and highly trained veterinary assistants are also monitoring those anesthetic components for our patients. We have the equivalent of a human pediatric anesthesia setup in this hospital. So our patients are under a nice warm air blanket. They're on top of a warm water blanket. We're monitoring blood pressure, EKG, pulse oximetry, right? So we've seen that a lot with COVID with patients that are like measuring their oxygen concentrations. Um, Additionally, we monitor how much carbon dioxide is exhaled because that carbon dioxide drives them to breathe, and we want to make sure that they're not having a buildup of carbon dioxide in their blood, not having good circulations and things like that. So those are kind of the things we're looking for and what we're monitoring and who is monitoring.
How long will my dog need to recover after having surgery?
Depends a little bit on the procedure, right? So routine surgeries or more common surgeries like spay and neuter, we're usually looking at about 10 to 14 days. More advanced procedures such as the removal of a spleen or a large tumor may take 2 to 3 weeks. Orthopedic procedures where we're going in there and refashioning or stabilizing a joint or a broken bone may take up to 6 to 8 weeks before your patient is ready to go back to a full activity level.
How can I help my dog recover at home after surgery?
Oh, the best thing to do for your dog at home is just to find them a nice quiet spot to sleep, right? Usually that first day after anesthesia, they're a little bit wonky from the gas and the medications, and they're a little agitated, sometimes whiny. And it's almost never because they're painful. It's usually because they're just a little bit confused. So finding a nice quiet space for them to rest. And then depending on the procedure as well, they may need like a really restricted area in the house. So the orthopedic procedures that we do here is in terms of cruciate ligament repairs and stabilization, fracture repairs, those guys are going to need a pretty nice confined space for about 6 to 8 weeks where they can rest anytime that they're not on a leash or being observed directly. Making sure that you understand fully the post-operative pain management protocol that's been sent home. So we go over those with you at the time of discharge, but then also have them in written discharge instructions for you to take home with you so that you can communicate that to the rest of the family. And so really just making sure that those patients are getting adequate pain management, that's the best part to make them comfortable. Awesome. If you have questions regarding your dog's